around in the pandemic. So the people that are, the spike in cases is attributable to younger people getting tested and testing positive. Those are not the people that are ending up in the hospital. The numbers that I continue to point people to that matter the most are the burden on the healthcare system. What is our healthcare system's ability to respond to this? And what's remained consistent throughout this whole pandemic is we've had about 2 people, not the same 2 people, mind you, we've had about 2 people in the hospital at any given time. It's gone up to I think 4, we may have hit 5 once. We've been down as low as 1. But we've got 26 ICU beds in this county between the 2 hospitals, and you know, at any given time, about 2 of them are occupied by people who are dealing with the virus, while the rest of the people that are active cases are recovering at home. We do in fact have 21 deaths now. Those are tragic. I believe 12 of those are people that were 80 or older. And again, all deaths are tragic. And I'm not going to say that it's okay that the deaths are people that are older. Those are the facts, though. That our youngest death was 64 years old. All of them, except one, which hasn't been identified yet, had serious medical comorbidities. So I believe the other one will when the autopsies are done. So it's clear who's highest risk for serious complications.
Thank you. Alderman Strawberry.
That being said, over 80% of people polled in the United States as a country would like masks to be mandatory. That was just published yesterday in the Chicago Tribune. This disease does not respect borders, so you know, you can't say that just that we're protected from it. As far as enforcing it, other communities somehow have figured it out. I don't think we have to say that we can't do that as well. I think that's pretty lame to say that we can't figure that out. And my argument before, as far as enforcing, I think most people follow the rules. And that being, you know, evidence of that would be at 2 or 3 in the morning when there's nobody out there and people come to a red light or a stop sign, they don't flow through it just because there's nobody there witnessing it. They behave. That is really generally what people do. They follow the rules. And especially as evidence keeps coming out, even the president just came out 2 days ago and said that he believes masks work, and the country is probably heading toward a federal mandate to have masks eventually because of the way the numbers are spiking across the country. So they may take it out of our hands anyway, but I'd like to see us be man enough to stand up and take responsibility and act in the right manner for our citizens, for our visitors, for our workers. I wear a mask every day, all day at work. We require it in the store that I work at. We don't have a lot of people that object to it, and we're doing it for the safety of our workers as well as our shoppers. It's just basic human decency to care about the other people.
Alderman Halverson.
Another question for Carlo. When I met with you several weeks ago, I floated the idea that many of the people who visit us obviously are from Illinois, and is it likely that they're bringing the virus back, or is that just an unknown factor?
This is, something we're gonna, once this pandemic subsides and we figure out what went well and what didn't, we're gonna find that the communication across state lines between health departments is almost non-existent. And we don't have any way to track the impact of visitors to Lake Geneva. You know, when we met, I had speculated that any spike in numbers we would see would be seen in Illinois because they're coming in, clustering in Lake Geneva and leaving, bringing it potentially back to their communities in Illinois. And when they test positive, we don't ever see the results. Those are shared with their local health offices. So it's really hard to gauge the impact.
Alderman Dunn.
I'd really like to hear the opinions of the police department as far as enforcement goes. So I make a motion that Lieutenant Christner be allowed to join the conversation and speak.
Motion has been made to suspend the rules and allow Lieutenant Christner to speak. All in favor? Opposed? Welcome, Lieutenant Christner.
Good evening. Obviously, it's It's an emotional issue, we understand that. As we spoke at FLR, we're for wearing masks. The reality of us enforcing not wearing masks, though, is there. There's a lot of ins and outs of that. When the governor put his first order in place, we had call after call about social distancing. That was extremely complicated to enforce because of family units. When complainants would call in and they observed our officers not break up a group of people that was in a family unit, we'd get another phone call about that. So it did tie up a lot of resources for something that was a real gray area. And at that time, we found out we shouldn't have been enforcing that anyway. We learned. This is the same situation. I understand the science behind it, or at least I think I do. But again, that's just my personal opinion, so I won't even go into that. But with that being said, we're concerned about the amount of phone calls we're going to take on it. Alderman Fesenmar's right when she says that one of our main mission is to ensure the community is safe, and we feel we're doing that by not promoting this in ordinance form. If we tie up our 911 and our non-emergency lines, we're not giving priority to the things that are of higher risk, domestics, whatever it might be at the time. So that's where Chief Rasmussen's point of view is on that. We do understand the complications that come with an ordinance like this. Another alder person discussed that other communities are doing this. We have not seen it on the enforcement side yet. Other police departments have just taken this on recently. We have not seen the complications or the lack thereof that they're having with it yet. It's too new, and we just don't know the constitutionality of it, to be honest with you. And I think that's been brought up by the city attorney as well, as far as digging deep and dragging this out before you go forward. So again, we're for wearing masks, but having it in this form, we think is going to make the city less safe due to the amount of calls we're going to take on because of it for emergency calls for sure.
Thank you very much. Any questions for the lieutenant? No, thank you very much.
Thank you.
Oh, okay.
From what I understand, the issue with enforcement, as much as anything else, is, for lack of a better term, the tattletales will be calling the police department saying, I just saw that guy walking down Center Street, he didn't have a mask on. That ties up the phone and communication lines, and it's not, I don't, from what I can perceive, the issue is not the officer walking the street, and we do have a lot of those on weekends. That's not going to be the issue. The issue is going to be when Jane Doe, the citizen, sees Joe Blow, the citizen, walking down the street without a face mask, and he wants to tell him to put a face mask on, and that guy says, no, we're not going to do that. And then it becomes a 911 call or a non-emergency call to the switchboard, and we only have so many switchboard people. And the way that our world is right now, people tend to be whistleblowers. They like to tattle on people, and if I have to do it, you have to do it. And I think that I just can see this turning into a real nightmare.
Our biggest concern is the 911. They will call 911 for this because we saw it with the social distancing aspect as well. People call 911 because they lock their vehicles in their car. So, I don't want to get into the tattletale rhetoric and all that, because obviously we want people to see something, to say something in any aspect of any law, but we just think this one's too hard to enforce. We have an officer respond to something like this, and the individual that was called in on tells us they have a medical condition, then look, we cannot tie resources up to vet if somebody has a medical condition, let alone if we even have legal standing to determine if they have a medical condition, and that's the reason they're not wearing a mask. So those are the challenges that we'll face and will be time consuming.
Alderman Dunn?
Just to emphasize, when they tie up the 911 line over something like their car keys or somebody not wearing a mask, that could cut out somebody who's got a fire, heart attack, a stroke, or some other really challenging, immediately needed assistance, and preclude that, so it could actually cause a death rather than prevent someone from catching the virus.
It could complicate our response time, there's no doubt about that. You know, I can't determine if it'll cause a death, but it'll obviously complicate our response time.
I think Alderman Halverson had his hand up first, and then Alderman Fessenmeyer.
Clearly, enforcement is an issue, and I think frankly, most communities that have passed this have had very soft enforcement. It's been a discretionary thing, and most of the fines, for instance, are $50, and it's nothing that is going to incarcerate people, but I agree that the phone calls would be a mess, and I think enforcement would be a problem, but I think we should pass something tonight, and in 2 weeks, readdress it. First of all, the COVID usually has a 2-week lag time, so in 2 weeks, we might have a whole different opinion from Carlo, and I think this is important to get this right. I think some of the people in the audience are underestimating what this is. It's a global pandemic that we have every century or so, and can't be compared to the flu, which is 1/5 of the death total. And I don't support outdoor masks. I don't support in all these cases they allow this discretion for people who have medical conditions. That's not an issue. And the question of sacrifice. In World War II, they had food rationing, they had scrap metal rationing, and they had and those things lasted for 5 years. All we're asking people now is for a few more months of just doing the best for other people, because that's what this is all about. I agree this is a complex issue, and I don't think we should drop it at this meeting.
Alderman Fessenmeyer?
A follow-up to Lieutenant Gritzner. So, and I don't want to get into the weeds, but I guess I'm assuming that if 5 calls come into the 911 center, they're stacked. So the first call is car keys, and the operator, let's just say they're doing it alone so they know they have 5 calls, and sees 4 calls in the stack, takes the time to find out about the car keys before they go to call number 2, in case clearly car keys on it. So isn't there some way that they're trained to sort calls when they can see their stack?
Yeah, we prioritize it,
Okay.
and that's why we're against
All right.
ordinance, is because we feel we can prioritize better without taking that volume of unnecessary phone calls.
Well, I'm not gonna argue with you. I think we should hire more staff to answer phones then. I think that if, a lot of the concerns, there is almost a whole page of exceptions.
Excuse me, are there any other questions for Lieutenant Gritzner? If not, thank you very much.
Thank you.
All right, Mary Jo.
Okay, so there are exceptions.
Mayor, I'm sorry, I did have a question for.
Oh, I'm sorry. I'm
Sorry.
sorry, I didn't know.
I was just looking my hand up, I'm sorry. I guess one of the questions I have is, when it comes to HIPAA laws, people aren't required to even disclose why they decide not to wear a mask, right? Like, if they say they have some medical reason, not like they have a card on them that says they have asthma, right? I mean.
Well, HIPAA doesn't apply to us as a law enforcement agency, but is that your question, if we've even asked that question?
I'm sorry, I couldn't hear.
What was your question?
I guess I was just asking how the rule of engagement would be from you and your staff if, you were to approach someone that wasn't wearing a mask because someone was complaining about it, and they just told you they had asthma or something. I mean, they don't have to, or they don't even tell you anything at all. HIPAA rules, HIPAA laws, they don't have to disclose wearing that mask. And how would you deal with
They
that
can honestly not
situation?
say anything to us regardless of HIPAA, and at that point, again, these are such complicated issues with an ordinance like this. That's why we don't feel it's enforceable, because the minute they tell us something like that, it's have a nice day. But then the problem is, we've got a complainant that just thinks we didn't do our job, so that's probably gonna garner another phone call on top of it. And again, it's too new. I don't know if we have legal grounds to take any action after somebody tells us they have a medical condition that would preclude them from wearing a mask, and that's why this is so complicated.
All right, any other questions for Lieutenant Kritzner? Going once, going twice. Okay, thank you very much. Any further discussion? Mary Jo?
I do not see these challenges as insurmountable. I think if you read the document that's in the packet, that was actually a melding by the city attorney of two different ordinances that have passed, taking reasonable language from different sections and putting them together. So I think the document that you have is what we should actually be able to debate rather than in general, because I think it makes it a little more fine-tuned. Also, I think we do have to look at the letter, the email we received from Visit Lake Geneva, pointing out all the places that have done this. So Dane County obviously is a county, but it's up to the municipalities then. So Whitewater, Glendale, Shorewood, Superior, Ashland, Madison, Green Bay, Racine, and Bayfield, and Wisconsin Dells possibly. So we're not out in the front on this at all. We're just joining the path. And we should be doing this so that our residents are assured that we are concerned in doing something about their safety. Our goal also should not be on what I call the no-fly list. So Wisconsin is on the list of not welcome to New York, possibly not welcome to Chicago. Is that the image we want to be as a state and as a city? I don't think so. Don't we want to be like places that have gotten this under control because they have used all the tools in the toolkit, one of which is the mask? So you have Taiwan, who, remember, we have 100,000 people in this county. Taiwan has 23.7 million people. They have fewer deaths and fewer cases. Shame on us. The same with New Zealand. They're opening back up, not letting us in. But these are places that have controlled the virus because they did the right things early on. We're still, unfortunately, early on in this. We're still in the first wave. We're not a year or two out. We have the capability and we have to do this now so that we can keep it under control. Do you really want? So we should be happy that our ICUs are not full. Do you really want to get them full and then go, oh, I'm sorry, we should have done something? I don't. I want to do it now. I want to make sure we're protecting our community. We also have to be concerned about our kids. I know that some of the speakers didn't realize that we do have a reopening plan for the schools. So we want to make sure our neighborhoods and our downtown is safe so that we can bring our kids back to school in safety by using all the tools, including masks. So I would like to, I'm going to vote this down because I think we need to discuss the specific ordinance. It's not listed as an ordinance on the agenda. So we need to vote this up so that we can put the first reading of this ordinance and pull it apart with supporting what we like. So again, I'm going to vote no. And I ask the rest of you in all, protecting our residents to vote no on letting this go, but instead voting yes to bring this ordinance to vote in 2 weeks.
Any other comments?
Her name, yes, me.
Alderman Stroudy?
I agree with Mary Jo. And another point that I'd like to make is that most universities are requiring masks on campus. Most school districts that are opening, if they open, are requiring masks in schools. I just think it's a precedent that if we turn our back on this, we're going to regret it. And we're going to look foolish.
Any other comments from any other alderman? Alderman
I'm
Fessenden?
sorry, one more thing I forgot. I've got people that are up here can see I have pages of notes everywhere. One thing that, what happened last time when we discussed this is the city attorney said that he was leery because we didn't have the justification. In other words, we didn't have the data. But we now feel comfortable that we do have the data. We have businesses here that have closed. Our kids work in those businesses. We have the Venetian Festival canceled and the fireworks. We now had some wisdom going on, and the county fair is canceled, which will help protect our kids because they would all go and then go to school. So we have these closures and cancellations. We have the county website that's showing that the rise in the case numbers. We know that. We do have a bit of segregated data in Walworth County to show our city is included in the area that has hotspots. So we do have enough data. So we shouldn't be afraid to be challenged by people that don't have the data. So I'm voting no. I encourage you to vote no, and then we'll do another motion to send this to the next council meeting so we can actually debate an ordinance and see what's in it.
Anyone else? Oh, Alderman Hellerson. You're muted.
I agree with Sherry and Mary too. I think at the very least, we should turn down the motion and send this, approve the ordinance or whatever it is, resolution, and send it to a second reading.
Vote on my motion first.
Did you have your hand up for a comment or no? Okay. So, Lana, would you read the motion, please?
Sure. I have a motion by Yunker to not pursue an ordinance requiring face masks, a second by Headland.
All right. Let's do a roll call vote on this one.
Besenmeyer,
No.
Flower,
You're
Yeah,
muted, Cindy.
Can I not abstain? Because I just really don't know. I'm still on the there. No.
Halverson,
No.
Headland,
Yes.
Howell,
Yes.
Straube,
No.
Yunker,
Yes.
Dunn.
Yes.
That motion is tied, Mayor. We need a tiebreaker, please.
Well, my whole issue on this is,
No discussion. You have to vote. Sorry.
okay. Actually, I don't have to vote. I can abstain, but I will vote yes.
That was a yes, Mayor?
Yes, ma'am.
Okay, that motion carries.
Item 15, discussion action regarding letter of support to be sent to